diabetes, they go to school, and most of the doctors right now they are advising them to take 4 injections a day. One short acting in the morning, one short acting in the afternoon, one short acting insulin in the evening, and also one longer acting insulin in the night. So now this has become a regular practice with the doctors prescribing 4 insulin injections to children, and it's a little inconvenient for them to do it in the afternoon during lunch time because of different reasons. There is also a problem of facing some sort of an embarrassment. So sometimes the children don't like to take injections in the afternoon, but the doctors advise them to take injection. And even with the best precautions and following all the instructions given by doctor perfectly, once in a week or twice in a week, children do tend to get low blood sugars. Low blood sugar means the blood sugar may fall up to 70 milligrams in the morning or about 100 milligrams in the daytime. If it falls less than 70 in the morning or 100 in the daytime, so they have some symptoms. Usually the children in the first few years or 1 year of getting diabetes, they do feel those symptoms like tremors or sweating in the palms or some sort of a lightheadedness or forgetfulness or some sort of a disorientation. So these kind of symptoms do not appear after a few years after getting diabetes. So they won't know. It's called hypoglycemia unawareness. So they don't know what is happening unless you do the blood sugar test. That's why it is mandatory that a person taking 4 insulin injections every day should have 4 blood tests. It is difficult, it's inconvenient also, but this is being insisted nowadays in the current diabetes treatment practices. So children who have diabetes should carry some easily digestible pulpy fruit every day in the morning when they are going to the school. And suppose if they get a low blood sugar and also symptoms like they are getting some sort of a disorientation, they can take sugar, they can take glucose, but not any tough or hardened chocolates. People usually say, please carry a chocolate or a toffee in the school bag, so that will help you in relieving the problems of low blood sugar. But it doesn't happen always. Be careful. If somebody is diabetic and the blood sugar falls to about 50 milligrams in the morning or about 54 in the morning or in the 54 in the daytime, their mouth gets dried up. So it's not possible for dissolving anything in the mouth. So suppose you put something in the mouth when they are actually low blood sugar and when the mouth gets dried up, so it's not possible. So suppose if you give a hard chocolate which doesn't get dissolved in the mouth, that gets stuck in the windpipe. That's a problem which we face often in some of these children with low blood sugar. So this is a very difficult situation. Suppose if the person is carrying any glucagon injection, that's a expensive injection. We don't advise people to carry glucagon injection in school bags, but sometimes the children are being advised to buy that glucagon injection and carry it. This is a powder, it's not a liquid actually. You have to dilute it with the fluid supplied along with that medicine, and then take it an injection, subcutaneous injection. This cannot be done by the child himself or herself. So either the nurse or a doctor or somebody who is nearby has to do that injection. So they need some sort of a training. So it's not always easy to depend on glucagon, but basically we tell them just take a easy digestible pulpy fruit every day in the school bag. Plus you can also take some sort of a glucose or something which dissolves in the mouth quickly. If suppose something goes wrong, they just have to take something that dissolves quickly. Even a fruit juice. Parents do not often like children to carry fruit juices, but that is also one sort of way to prevent or for treating low blood sugar. So these are the things which you have to carry in the school bags when children go to schools.